because you never know what I'm going to say. It's really nice to be here. I was saying it's been a few years since I've been in this building and this facility, but I always love coming back down to Mercer County. I know that while I served as Attorney General for 12 years, sometimes people used to joke that I was one of the few people that knew my way around, in the southern part of the state. And that's because I think that all parts of the state deserve a lot of attention and focus. I think there are a lot of great things going on in Mercer County and in southern West Virginia, and I want to make sure that we're all communicating and working together so that we can really achieve greatness for our state. And I look around the room, I see a lot of friendly faces and people excited about what the future holds. And I was here for some good news today, and especially glad to be here because I certainly have been down in Mercer County and southern West Virginia quite frequently to talk about the drug epidemic over a long period of time. There are probably no bigger issue that I worked on for a 12-year period, and I used to spend hours every single day looking to change the direction that West Virginia was headed. And to be blunt, with certain limited tools, because in West Virginia, the Attorney General doesn't have the overt criminal authority. That's at the local level, and we have good prosecutors and people doing, you've got your prosecutor here today doing a lot of good work, but there are limited tools, so what we have to do is really end up driving major changes on a number of levels to reduce the supply on the civil side, which then changed the nature of the problem, which I think now we're beginning to see some of the benefits from. But then to think about this problem holistically, attacking it from a supply, a demand, and an educational perspective. And that's exactly what we did. And we had a very specific strategy in terms of not only ultimately trying to achieve meaningful progress, needle movement, in terms of reducing the number of opioid-related deaths, but also in terms of how money could be best used to address the problem. And you may know that over a long period of time, a lot of people were very critical. They were attacking because they didn't really know strategically the pathway we were going in. But we said no to the national settlements. We said no to just the quick spend money, just thinking of it as pork that should be distributed, that doesn't meaningfully move outcomes. We said no to all that. We took grief. They did a lot of campaign commercials, but we stayed the course. And ultimately, I think you're beginning to see the fruits of that. When I look at what's being done right now in terms of the West Virginia First Foundation and the efforts gone on with the local counties and the state and others, I look at this as an incredible chance for West Virginia to ensure it never loses another generation to senseless death. And that's what our goal is, right? And if we do our job correctly, we're not only making meaningful progress in reducing substance use disorder and reducing the number of deaths, we're actually addressing one of the core economic problems that West Virginia faces, which is a very low workforce participation rate. I've always thought that the drug epidemic and the workforce participation rate, they go hand in hand. And when West Virginia has a workforce participation rate that's 54.2 or 54.3% compared to a national average of 62.1, that's a real problem. Now, there are a number of reasons for that, both in terms of the age of the population, the disabilities that our citizens have. I think we're at the highest disability incident rate in the nation. So there are factors that drive that. But there are things that we can make meaningful improvement in. And certainly in the area of drug abuse, that's one of them. And so it's exciting to come here and talk about what the future holds, because while we're here today to celebrate some meaningful movement in terms of statistics that are really incredible. And I want to thank everyone here, the delegates, our Human Services Secretary, all the people around the room, our team, our West Virginia First Foundation, our West Virginia First Board folks at Human Services, the leadership across the board over the last 5 to 10 years. People have been working as a team. And so a lot of times when people ask me, well, what's the main mover in terms of the change on the death? Well, it's multifaceted, right? I'm not here to point to one thing. We could run around and say it's only this. Well, that's nonsense, right? This is a very complex socioeconomic problem, and it's rooted in a lot of dysfunction economically that the state's had, and the terrible poverty that we've had over a long period of time. When you have an entire town wiped out and no longer having those coal mining jobs, what do we think is going to happen to those people? Those folks got consigned to poverty, and some people end up going in the wrong direction, and ultimately got addicted because they lack the connectedness within the community, the human contact that you need in order to make sure you can tackle addiction. Now, I was always fond of remembering all of the studies that I used to read over the years, and they used to have them with mice, and they would show what would happen when mice were actually not connected to other mice, and then they would put in poison, and if the mouse was alone, the mouse would keep taking all the poison, but when the mouse was with all of the other mice and could interact, the mouse would not ever go to the poison. It was a wild thing. Well, there's a lot of similarity in terms of that connectedness issue that we see with human beings as well. So I'm happy to be here today and to talk about these issues because they're fundamental to Southern West Virginia and, quite frankly, to the state as a whole. And certainly, this is a critical issue. It's always been top of mind for me. And I think it's been top of mind for the citizens of our state. We know that for a prolonged period of time, decades in fact, the opioid epidemic has ravaged West Virginia and also a lot of the counties in the South. And we know that that evolved over time from being focused on the legal pain pills to other really deadly types of drugs. In recent years, you've heard me talk a lot about fighting the fentanyl menace. And I've talked to the feds a lot and really pushed very hard for different policies to crack down, to have more prosecutions. That's starting to happen more in recent years. We know from a policy perspective, there's been more thought given to having that approach that looks at substance abuse treatment, prevention, and enforcement. It's a three-legged stool. All those people that will tell you it's only about one, they're not being honest with you. They're just focused on getting the dollars in their one category. We have to think about this holistically, and that's part of the reason we're here today. We know that as the pain pill epidemic evolved, fentanyl really began pouring into our country at a very alarming rate. And it came across the southern border in a way that I think we never saw before. And that really drove a lot of the deaths. You saw people move from the pain pills over to fentanyl. It's one of the reasons why in April I signed legislation, and many of the gentlemen here today were part of this, Lawrence Law, that actually increases the penalties for high-level drug dealers and really goes after the offense of delivery and some of these drugs resulting in death. And I think that's important. It really cracks down more on fentanyl, sends a message we are not going to tolerate the peddling of death in West Virginia. That was key. And we know that drug traffickers are going to be held accountable, right, Mr. Prosecutor? Yes, sir. Absolutely. So I do think, though, that we are beginning to make progress. We're turning the tide. But we're not going to thump our chest. We're just going to keep working ahead. I want to talk about what that future looks like. But I do want to thank the people that are helping us move the needle. First, I want to thank my old office, the Attorney General's office, that spent 12 years working, toiling, trying to move the needle. And what we did is we ended up creating the single largest settlements in the country, not by a close margin, significant differences. That matters for our West Virginia citizens. Number one per capita settlements, over $1 billion. That's going to afford the local counties and the West Virginia First Foundation the opportunity to be really thoughtful in terms of how to tackle this problem. That's why we set up a structure that's a little bit more removed from the political forces that, quite frankly, used to waste the money. When I first got in, I would send the money up and boy, it was not well spent. And people would want to change how that happened. Well, I'm thankful to say we worked with the legislature last year and we came up with this West Virginia First Foundation model. I thank them, they blessed it. No one thought we could do that, but they we all stuck together as a team and it's made a big difference. So I know that I'm very proud of the work of the West Virginia First Foundation and what you're doing. You're really getting off to a fast start and it's terrific. It's literally one of its kind nationally in terms of how it's structured, kind of a public-private partnership and that foundation. And I want to reemphasize, it's not only to take the existing dollars within that you have from the settlements, it's to actually engage in finance development so that we're going to have the tools that we need to address future issues. And we have to develop that development function of West Virginia First, because at some point, a lot of the government money runs out, right? You see that with a lot of the discussions that are occurring nationally. But I'll tell you, West Virginia First, the counties, they're giving a lot of resources away. They're giving money to law enforcement, so you can have some of the success through diversion programs, prevention programs, attacking the problem of drug abuse in the schools. I'm excited about that. We know that there have been some initial opportunity grants that have been put out, but what really excites me about working with the West Virginia First Foundation and our Human Services Division and our Department of Health is to be able to now take advantage of the next opportunity. That's why I really want to emphasize today that we are going to be working collaboratively with our Human Services Department, with West Virginia First, and the private sector to take advantage of the new monies that are available within the bill that was just signed into law by the president last week. A lot of people have talked about the impact of that bill on Medicaid, on the tax cuts, and we certainly really like the tax cuts, I do at least. But one area that hasn't gotten much attention is the fact that every state in the country has access to a rural transformation fund. And each state is providing a minimum of $500 million. That's a game changer. And it's an opportunity for us to work together to harness the power of technology, AI, and to really help rural healthcare outcomes get improved. The way that those resources are set out, the monies have to be used, focus on improving outcomes. That's an incredible thing. We want to leverage technology to do that and build out that technology infrastructure in a way that's going to allow us to tackle the really tough healthcare outcome challenges we have. Whether we're talking about diabetes, we're talking about obesity, we're talking about cancer, or substance use disorder. Now think about partnerships that may emerge. This is really incredible. The private sector, with the counties, with West Virginia First, the federal government, on how we can use those dollars and really move the needle from an outcome perspective. Isn't that incredible? Not just focused on pork, but focused on opportunities to do good and evidence-based tools that move the needle. How about that? That's the opportunity we have in front of us right now, and it's an exciting one. And that's part of what I wanted to come here today and talk about, because I think if we do that, we can build on some of the success that we've had. The fact is that we are making progress in getting a number of the numbers down. I know some of the recent months have been very favorable in terms of opioid-related deaths. Since 2021, West Virginia's had some important statistics. Opioid-related deaths, they fell nearly 69%. Fentanyl-related deaths, down over 71%. Meth-related deaths, over 64%. You think about that, but we can't rest on our laurels because West Virginia was started with the highest number. So we have to double down. And I think what we're talking about doing, these partnerships, working with the legislature, working with our departments, working with the counties, West Virginia First, the private sector, this is our chance to really improve healthcare outcomes in our state. That's why I wanted to come down and talk to you guys about that, because we have a chance to really do some special things in West Virginia. We're poised to make the changes that are going to allow our workforce participation numbers to grow, to lift up our standard of living, and to really improve healthcare outcomes in a way we haven't seen before. If we're disciplined and we're focused on leveraging the tools that we have, and we're focusing on merit-based programs, not just political pork. And that's the approach we've tried to take. So I'm really happy to be here, especially pleased to be back in Mercer County. I know that there have been a number of challenges. I'm glad to see some of the delegates from this region here. They've been all good working partners, and I'm pleased to work with them and to be able to do really good things for the state. We've got some talented people here. I enjoy working there. Say the vast majority of people in the legislature, they're trying to do the right thing. Yeah, you always find a couple people that aren't quite, with the program, but we'll deal with that over time. But these are some good people, and that's why they're here today. And we've been working closely with them to try to make sure that we're advancing progress for the state of West Virginia. So quick takeaway again, we're making progress. Reductions, significant reductions since 21 in terms of opioid and fentanyl-related deaths. Highest reductions in the country, according to CDC, for recent decline in opioid-related deaths. And then going forward, an opportunity to build and be transformational to attack healthcare outcome issues through the resources that exist now through West Virginia First and the counties, and other resources that are coming in through the bill that was just signed into law by the president on Saturday or Friday. So I'm excited about this, especially glad to announce this right here in Mercer County, and certainly looking forward to working with you. So with that, I'd love to first turn it over to Jonathan Bourne, who is doing a great job as Executive Director of the West Virginia First Foundation.
Good morning. Yes, it's wonderful to be here on behalf of the West Virginia First Foundation, our chair, our board, and our team. Thank you for all you do. The governor is being a little perhaps humbled in this statement. You have to understand what the work he did as AG and continues to do as governor, where that positioned the West Virginia First Foundation. You mentioned that our share, our award per capita, is factors higher than any other state. That's any other state in America. That means each and every one of you is better positioned than anyone else. That's incredible. It also enabled us to establish the first and only opioid settlement foundation that is wholly private. That means that we can move at the speed of a public health crisis. That's incredible. That's enabled us to do quite a lot. Be unencumbered by unnecessary bureaucracy, but also hold to all notions of transparency. We're an open book. We talk with everyone honestly and openly. So what's that allowed us to do? That's allowed us to be the fastest to deploy opioid settlement funds back into the state of discharge. In America, we became operational last May. In the fall, we announced an RFP, and in the winter, we announced awardees. That's extraordinary. Let that sink in. I think that's really important. You had nearly $20 million pushed out into the state that quickly to 94 unique programs. We set up a direct funding model. We set up now the next funding cycle as well. That's big work, and that's because of the work that he and his team have done. We're the first and only settlement foundation to set up gap funding for some of those organizations, what I call the mom and pop organizations, that may win a state award, but they don't see that money right away. And they immediately have to start satisfying KPIs and milestones, but they don't have the funds to do it. We're going to stand alongside them and make sure that they have those funds. This is unique and novel in America. There are so many firsts here. So it's positioned us for our next steps. We're going to focus on needs-based, necessary elements where there are gaps of service throughout this state. And then we're going to let evidence drive those decisions, always focused on outcomes. We have to have meaningful outcomes that are consistent across the board. There is truth here There are things that work and things that don't. Let's focus on those things that work. This is really legendary stuff, and we are so thankful for the work of the governor and his team, and his AG, and now governor. We're blessed with that. We're very thankful too, as mentioned, for our current AG, who's picked up that and now stands alongside the governor as we move the ball forward. But today I want to celebrate all of you, the boots on the ground. You have worked tirelessly in this space. West Virginia leads the nation in a lot of challenging categories. The overdose rate was one of them. When we started this, we were triple the national average. Triple. We are now a full factor less. And we're just getting started. This is the tip of the spear. The work of the governor, the work of the AG, so many others. All of you are making that happen. We are so thankful for that. And we'll make a commitment now with the governor here. We are not going to commit intergenerational theft. We are not going to throw all of this away with today's known needs against tomorrow's unknown needs. Generations from now, people will ask what we did with the time that was given to us. We have every duty and responsibility to them. And so we've got to be balanced. We've got to be smart. And as we talk about partnerships, focusing on AI and new technologies that help us refine and define what is success, I look forward to joining with you and making that happen. This is an extremely, vitally important project, and it's one we are privileged to be a part of. And I want to thank all of you here and all of you and everyone out there who works so hard, sometimes tirelessly and sometimes thanklessly. On behalf of all West Virginians, we thank you today. And let's just keep working. Thank you, sir.
Great, thank you. You know, one of the fun parts is when you serve as the AG, then you get to pick the executive director. This guy's doing an unbelievable job. Let me tell you, when we first did this broad national search, he wasn't in the first category, and then as we went to the next level, all of a sudden, you know, as we discovered, we got a chance to get to know him. Boy, everyone thought that this was the most incredible pick. So, I tell you, we have a gem in Jonathan Ford, and I'm really pleased that he's doing the work he is. So thank you, Jonathan, for all your good work. Now I'd love to hear from someone who I think is so committed to helping the kids of our state, moved his family here. He's known as an expert on a lot of kids' issues and knows the importance of battling the substance abuse epidemic. I'm really pleased that he joined our administration. Alex Mayer, our Secretary of Department of Human Services.
Thank you, Governor, and appreciate the opportunity this morning. The West Virginia Department of Human Services is proud to share the progress that the state's made, and it's not made just by one person, as the Governor pointed out. It's made by state agencies, the commitment of communities, people involved in this effort, and as a result of that, and the commitment of the Governor, we've seen great progress and continue to see great progress. But as he said, this is just the start. This is an opportunity for us to continue on that success and continue weaving our system together to be more impactful. These achievements are a result of the collaboration across the entire system. And one of the most impactful initiatives has been the distribution of more than 90,000 naloxone kits, providing 180 life-saving doses each year from 2022 to 2024. While saving lives is critical, it's just the beginning. Our mission goes beyond survival. We aim to help individuals recover, rebuild, and thrive by connecting them to effective treatment and long-term supports. In 2017, West Virginia had only 197 residential treatment beds. Today, we have more than 1,800. Thanks in part to the early settlement investment dollars secured by the Governor and his leadership as Attorney General. This expansion has strengthened our commitment throughout the continuum of care, and to date has cleared individuals engaged in treatment and are far less likely to experience fatal overdoses. But recovery doesn't just end when treatment does. That's why the department continues to invest in programs and other initiatives. Today in West Virginia, we have 106 certified recovery residences offering 1,400 certified beds that help individuals maintain recovery, rebuild their lives, and create supportive environments. We also recognize that support of families is critical, especially mothers and children. which is a cornerstone of the work that we're doing. In partnership with the Department of Health, the Drug-Free Moms and Babies program now operates at 25 locations statewide, integrating maternity care with behavioral health services. As a result of those efforts, at the start of these programs, we see 70% of participants testing positive for illicit substances. By the end of their pregnancy, that number drops to 29%. And as the governor mentioned, a lot of my background is in the child welfare space and child issues. And so in that vein, because of these efforts and everything that we've seen a 44.2% decline in neonatal abstinence syndrome between 2020 and 2023, and a 38.7% decrease in the number of children being removed as a result of substance use in the state from 2017 to 2024. Together, these results show what's possible when we invest in people, prevention, and care, and work collaboratively across systems. On behalf of the West Virginia Department of Human Services, I want to thank our partners who have come alongside us to support this work and achieve these outcomes. I also want to thank the governor for his steadfast commitment and his leadership in this area, which supports a growing, thriving, and healthier West Virginia. Thank you.
Now I'd like to open it up to any of the legislators who would like to say a few words. Marty.
Thank you. I'm glad to be here today, guys, and I'll tell you a couple things about Alex. If you have any question about his commitment to health, you should show up with him at the gym in the morning. Because I'm gonna tell you, I've watched him push some plates, and if he flexes over here, that suit's not gonna last. So, I'll also tell you, when it comes to the drug problem, my friend and colleague for the last 15 years, Delegate Ellington, knows that anytime that I deal with anything that ends in INE or ONE, I call him, because I don't know what drugs are. I don't know a thing about them, I've never used them, don't drink, don't smoke, don't do any of those bad things, maybe other bad things, but I don't do any of those things, so I don't have a lot of knowledge about it. I do know that we're talking about some pretty good numbers, having gone to work on a problem that need to continue to happen. And I know we're talking about a lot of money that's going out to try to solve these problems. But I will tell you that the governor has a different way of working on these problems also, whether he's going to recognize it here or not. His agenda in the last legislative session put us in a position to continue to improve this economy with regulatory reform, permitting reform, a variety of business initiatives. The state legislature has reduced the state income tax by 27% over the last couple of years. And in the words of my old friend Bill Cole, there's nothing to give an individual more hope when he gets up in the morning than to have meaningful work to go to. He's got work to go to. He has a whole lot of consideration of getting up in the morning and doing drugs. We're improving this economy so that we won't need to have these dollars that recover folks, so that they can get out of bed in the morning and have meaningful ways of not going to that hopelessness that's found in drugs. So these are great things that the governor's agenda this fall, and he will tell you that 98% of it he and I were on the same page with, and all of it that improves our economy, improves this particular problem, and I think is responsible for a great deal of the numbers that he reflected to you earlier. Thank you very much, and thank you, Joe. Thank you.
Any of the other legislators? Doc? Senator? Absolutely. Appreciate it.
Thank you, everyone, for being here. And I want to say, Mr. Ward mentioned needs assessment. I'm a firm believer in that. That lets you know where you need everything at. And Governor, I know you're a fiscal conservative, and I know you're going to make these funds go to the proper places. I'm excited about that, and I look forward to all your proper spending of it. And Secretary Mayor, your child welfare focus is what we need this time really into these drug problems that so many kids without homes, and your focus on that is great. I look forward to working further with you and you two, Governor. Just thank you so much for everything you're doing. So.
He's a senator from Mercer County, I think now, right?
Yeah.
No, but I mean, that's your residence.
No, I live in Wayne County.
I'm kidding. I hear, I see him all the time. That's why I'm saying that. Doc. I was just having fun. He spent a lot of time here, I'm gonna tell you that.
I wasn't planning on saying anything today, just to support the governor, but there are a few things I would like to just say briefly. I appreciate all the work everyone has been doing, community too. Most of you know me from Mercer County since I'm a delegate here. Governor, I don't know if you recall, but in years past, I first met you when you were Attorney General, and I was in charge of health and subsidies in the House. And there was a lot of legislation that we moved at that time because of the crisis that we had. And you were instrumental with that along with my colleagues in the House and the Senate. We did take a pause for a while at that point to fine tune legislation, but also to see what the results of that legislation would be before we enact anything further. And this is a positive step that we're seeing this year. So I appreciate those results that each of you have presented and the work you're doing. Continued work in the legislature will help. As you know, I'm in charge of the education part of that in the House. Our youth, K-12, our workforce, very important. Substance abuse affects each of them. And we have a lot, much more to do, and we're not going to quit. We appreciate that news you have and the funding that they become excellence. So thank you very much for all your work. Everyone else for all your work. Everyone else.
Yeah, thanks. Delegate David Green, this guy, I will say, he is the most staunch advocate for McDowell County.
Appreciate you coming. Thanks, sir. And as the governor said, I am from McDowell County. I truly appreciate the effort that this whole entire process has been putting into. The drug epidemic is truly an issue for a lot of our members and residents of West Virginia. And Governor, as it's already been echoed, but I truly mean thank you for your work as Attorney General. You know, I love the fact of getting money to a problem, but not just throwing it at the problem, but really doing some deep dive research to figure out how the best way to take that money and to make it the most meaningful. So thank you for your efforts as Attorney General, now as leading the charge as Governor. And thank you to everyone that sits in this process. We are truly changing lives of men and women who go through this every day and face these issues. And I just thank you. Seems very small, but I truly appreciate all your efforts. Thanks, Tom.
Delegate Cooper, nice to see you.
I don't usually knock things over when I walk. Sometimes I fall, but I don't always fall on anything. Thank you, Governor. Thanks for inviting me. For those of you who don't know me, I represent Monroe and Summers County, but this is a big deal. What the governor has done in his years as Attorney General, and what he continues to do, and what we as legislators are trying to help him do, and trying to help become part of the leadership, does a couple of things. And Delegate Gearhart mentioned them, as did Doc Ellington when he spoke. But one thing we do, we give hope. We think what we're doing now will give hope to the employer, hope to the parents, to the families of these folks that have become entrapped in such a cycle. And we hope it will give, I hope, and I think it will, give hope to those individuals who are stuck in that cycle if they know consistently, and that's the key word here, it's consistency. If we consistently over time take the same route and keep on keeping on, because we offer hope to those three groups and to the rest of our economy, because folks, our economy hinges on its workforce. And as the governor brought out, 53 or 54% participation rate is not good for West Virginia, not good at all. And I thank you all for letting me speak, and thank you, Governor, for inviting me to come today.
I know we also have a couple other people who've been working tirelessly. Thank you, Director Mullins. Thank you so much, Dr. Lloyd. There's so many people here that are doing incredible work. And I want to make sure everyone knows, whatever your position, whether you're in the private sector, whether you're working in state government, there's an important role. And we attack these problems as a team because we know the importance of every part of the system, the criminal justice system, the healthcare system, the educational system, the importance of that. And so that's a lot of what's been happening in recent years. that there's been a lot more collaboration and communications back and forth. I'm a big believer as governor. I talk to my team all the time. We have to have really effective communications loops. That means you bring everyone involved in the problem, feedback out, feedback back in, coordination, collaboration. That's what you're seeing with respect to the drug epidemic. So I applaud everyone who's here today. With that, I'm going to conclude my prepared remarks, but if the media has any questions they'd like to ask, I'm happy to answer them. Anyone up there? Is that Charlie?
Yes.
I can't see that far. Any questions, my friend?
Yes, you mentioned about how you evaluate these programs for the money from opioid, fentanyl abuse.
Can you speak up? I'm sorry, I can barely hear.
Sorry. You mentioned how you evaluate these programs you're putting money into, whether they work or not, using a merit system to do that. You have a mechanism in place for people to evaluate these individual programs, and if they're not working, it's work.
Yeah. Well, look, I can tell you my philosophy for anything that comes before my desk is that we look at evidence, we look at return on investment, and not just because someone pushes it who has an important name. You have to go through a process, and you have to show that precious taxpayer dollars are being spent effectively. These aren't my dollars. These are the people's dollars. And so what we do is we look at every program and we ask the question, should government even be involved in it? That's important. That roots a lot of stuff out right away. But then we say, what's the proper function? If it's a proper function for the government to be involved, how can you advance that in the most cost-effective, high-quality manner out there? And you look at all the traditional metrics that are out there. One of the things I'm proud about is that there were early settlements that were made and monies were spent, and yet over time, that changed and evolved and eventually became the core of the West Virginia First Foundation, where there was money that was split between the local counties and the foundation. And I think that the mechanism for how money is going to get distributed to the communities and the grantees will be superior. Because what happens sometimes in politics is that there could be the loudest person that may get it. You know, this happened in the area of treatment beds, for example. It is correct that there was a dire need for treatment beds, but you saw up front, there were a couple cities where a lot of the beds were congregating in one area, and that was not a rational policy. Well, that changed over time, but it changed because people learned the lessons to not just listen to someone who is the loudest, but to actually think through what the needs of the community may be. That gets into what Jonathan Board talked about. What's the needs assessment that's done within the community? The needs of Mercer County, McDowell County may be very different than the needs of Grant County, where they may be focused on transportation issues, or in Jefferson County, or in Hancock County. And so you have to factor all of the unique differences of the geography and the people that you're dealing with. And that's what we try to do, both on opioid issues, on healthcare issues, and everything that comes before our desk, because it's the taxpayers' money and it deserves to be spent wisely. Any from the press?
Yes.
Press, what's your name, sir?
Greg Jordan, Daily Telegraph. And you mentioned a mechanism for distributing the West Virginia First Foundation money. How will that work?
So just to be clear, the governor's office or the state government does not distribute the West Virginia First Foundation. If I referenced it, it's because when I was the state attorney general, I helped write the West Virginia First Foundation bylaws and created the agreement between the state of West Virginia through the AG's office with an agreement with all of the counties and cities as ratified by the legislature, which I thought was very important. So all of that is set out in statute and through West Virginia First Foundation. So I don't want to imply that we're in charge of that. We appoint the board members, 5 of the board members of the West Virginia First Foundation. The Attorney General appoints the executive director. So I just want to make sure we're clear on that. Other requests from the meeting? Yeah? And can you say your name first?
Serena Devanzo, WOAY.
Yeah, great.
So now we got this going on. What are going to be the next steps going forward when it comes to the opioid epidemic?
Couple things. One, I know that I've had a number of good conversations with members of your board, but also with the executive director of the West Virginia First Foundation. I think you're going to look to see opportunities for us to collaborate on big issues of the day. I specifically mentioned that there were resources that were made available in the bill that was signed into law. Obviously, HHS in Washington has to set out a number of the rules about how those dollars can be expended, but we're going to be putting together an internal task force from within the government, and obviously we want to give input to others in terms of the public, how money could be best spent. But we also want to collaborate with the West Virginia First Foundation, because if you're talking about moving the needle in terms of improving healthcare outcomes in the state, I certainly think that addressing the substance abuse problem should be part of it. So I would anticipate that's going to be one of the next things you'll start to hear about in the upcoming weeks and months ahead, especially as HHS releases its public guidance. A lot of times we have to wait until the feds release their guidance, because if you get too far ahead and they have prohibited uses, you want to do this the right way. So just the same way, I think we've been very strategic on BEAD. We're going to be for this rural healthcare transformation grant. Any questions, any other from the media? Yeah.
Cameron Gano, 59 News. Thanks for having me.
Yeah.
You mentioned being strategic with the funds used to combat things like the opioid crisis. Putting a lot of action toward prevention, getting ahead of the problem, very smart. What guidance would you offer to local leadership, say on the county level, when they're towing the line between going into things like prevention, but also needing to address immediate needs of like EMS and like equipment needs, things like that? How would they balance that?
It's a great question, and quite frankly, it's something that every government official should grapple with every day, because I think the duty of a public official, regardless of the position, is that you not only have to address the immediate needs, but you have a duty to think about the future and make sure that we're answering this question the right way. Will our kids be better off with the policies that we're pushing forward? And that means not just look at the here and now, that we're going to do things just to get elected, that you're doing things investing in the future. So I would say that the same applies on the local level. There are a lot of opportunities, needs that exist today. I've always been a believer that you take some of those dollars, you expend them based upon the needs assessment that's done, based upon evidence, but you also make sure that there are opportunities to fund for the future, because if you just spend everything and you wake up and you have nothing left, then your kids are going to be saying, well, where are we here? And we have to make sure we're addressing the needs for our future so that we can be well positioned to lift up that standard of living. Just lifting up the standard of living alone in West Virginia, do you know how much that's going to drive improvement in a lot of these numbers? That's going to make a big difference. So I would say there's a balancing act, and I would urge people to, take that responsibility of addressing the immediate needs now, but also investing in the future.
Thank you.
Any final questions from the media? Well, I want to say thank you very much to everyone who came here today. It's just great to be back in Mercer County, and I hope to see folks again very, very soon. We have good news today, but let's not rest on our laurels. Let's work as a team. State government, working with local government, working with the legislature, working with the private sector, West Virginia First Foundation, and let's continue to move forward on outcome improvement in the state of West Virginia. Thank you and God bless.